When diagnosing and treating cancer, time is of the essence. Early diagnosis and treatment can be the difference between life and death. A Qlik visual analytics solution at the Royal Glamorgan Hospital is helping staff visualise cancer care in their region and streamline the patient pathway.
By the River Ely in the Rhondda Cynon Taf area of South Wales is the Royal Glamorgan Hospital. As in England, the target for cancer treatment here is just 62 days from urgent referral.
What I'll show you now, Paul, is the live apps that we've developed.
The hospital sees 400 to 500 suspected cancer patients every month, and now they can generate clear dashboards on performance, including bottlenecks and delays.
This allows us to develop information based specifically for relevant tumour sites. So, for example, there's a colorectal site, a urology site, a skin tumour site, and allows the service managers in those areas to manage their own cohorts of patients, to understand where in the pathway the patients are. So have they had their first outpatient appointment? Are they awaiting diagnostic test results? Are they waiting referral to a tertiary centre? Or are they waiting the treatment within our own health board? And that allows them to do it dynamically rather than just in looking at patient lists.
What we've got here is a record of all the cancer referrals we've had in the organisation for the past 4 years.
These dashboards are generated by Qlik software. It's much quicker than the old system of requesting reports from the information department.
As the cancer pathway is measured in days, as opposed to weeks or months, then you need to know where the blockages are in those pathways at a much earlier stage. Qlik has allowed a lot of those users to become self-serve. In other words, they can ask their own questions of the data, a lot of the times without coming to us as an information department. It solves two things. A, we don't necessarily have to have an increased resource to do it, and the time scale is very much under the ownership of the requester. They self-serve, they ask their own questions, they get it when they want.
The applications pull in information from many different sources, have huge capacity and are versatile.
What we find when we're using traditional tools is that they have a problem with handling very large volumes of data. Qlik doesn't have this problem. We can have millions and millions of rows of data that we couldn't use before, and suddenly that's all accessible in a web front end. The health board has a lot of different systems that it uses for all aspects of information gathering, whether it be clinical information or whether it be portering or finance information, human resources. Now, if everybody is using Qlik and we're bringing all this information together and able to put it in Qlik, we're able to share it much faster.
The board's finance director told me when it's fully rolled out, it'll transform how clinicians work, giving instant visual answers to vital questions.
Getting regular, hard information on readmission rates. How many of their patients get readmitted within 30 days, which is an indicator of quality. How long do their patients stay in hospital, how many patients they are seeing on a day case basis. Now those sorts of things, that is not easy for them to get that. Through Qlik we can show them not only that information from them, but how it compares to their colleagues, how it compares to other hospitals, and that is going to give them a more rounded sense of what they're doing.
This software was developed for use on mobile devices, so mobile phones and tablets. And this means that clinicians and managers can access information about patients wherever they are. This kind of speed and accessibility is making all the difference. You can just access this anywhere you've got Wi-Fi?
Absolutely. So anywhere where there's a Wi-Fi hotspot in health boards or health trusts, you can roll it out to clinicians, nurses, operational staff, as wide as the organisation allows, so that they can ask questions of the data in a very visual way and on a very mobile device. You know, we typically use 2 devices a day, and we expect to get access to data no matter where that data is.
These user-friendly dashboards allow staff to spot areas for improvement quickly, in cancer as in other health disciplines, as well as in operational issues.